Hello and welcome, everyone. We are super excited today to kick off our InnovateHer panel series. On a quarterly basis, we're going to be bringing together Femtech leaders who use technology, community, and innovation to create a healthier and more equitable future for women. I'm Vicky Zoe, and I'm a partner and director at BCG Digital Ventures, and I lead our Women's Health Initiative here. And I'm here with my colleague, Sam Jurashka, Director of Product at BCG Digital Ventures. So at DV, we work at the intersection of corporates and startups. And for our panels, we're proud to feature both startup founders as well as corporate leaders. Today, we're super excited for our inaugural panel on the topic of reimagining women's health. Can technology address unmet needs and health inequities in women's care? Please feel free to enter any questions you may have in the chat as we go along. We'll also save some time at the end for audience questions. I'm thrilled now for you to all meet our fantastic lineup of speakers for today. We'll go ahead and get started with Priyanka. Can you please tell us a little bit about yourself and your company?
Amazing. Yes. Thank you so much for having this and also for having me and also doing this series of panels. It is so exciting to see more people paying attention to this very important topic. But like you mentioned, I'm Priyanka and I'm the co-founder and CEO of a company called Evvy. We're focused on discovering and leveraging female-specific biomarkers, starting with the vaginal microbiome. So what that actually means, women weren't actually required to be in clinical research in the US until 1993, actually June 10th, 1993, which is a holiday that we are trying to create this year called Equal Research Day this Friday. You can check it out at equalresearchday.com. But essentially, because we never studied women, so many of the biomarkers that we use to define whether someone is healthy or sick are essentially based on middle-aged, mid-sized white men. And for a very long time, we assumed that women are small men. And obviously that's not true. And really excitingly, we actually have a lot of really unique biomarkers and signals that our bodies are constantly giving off, but we don't do a great job actually measuring or tracking those unique signals today. And that's really what we're interested in at Evvy, starting with the vaginal microbiome, as I mentioned, which turns out is a perfect example of what I just mentioned. Not only is it the cause of the most common conditions in women, I mean, we've all been there, recurrent UTIs, bacterial vaginosis, yeast infections, et cetera. But turns out that also the composition of the vaginal microbiome plays a huge role in broader female health outcomes from, we're going to hear more about IVF outcomes, fertility, preterm birth, cervical cancer progression, and so much more. And yet, as people with vaginas, we never had access to that information, and no one in the healthcare system was really using it to provide more precise care. So that's what we're hoping to change. Thanks again for having me.
Thanks so much, Priyanka. Alyssa?
Hey, I'm Alyssa and the founder of Lilia. We're a YC-backed company, and we are working on making egg freezing as common and accessible as birth control. So with Lilia, women can freeze their eggs for half the cost on a condensed timeline with a community of other women and with world-class clinics and top fertility doctors. And kind of similar to what Priyanka was saying, today the egg freezing experience has been designed as if these young women are small IVF customers. And so we end up going through a process that's really bloated, and it ends up being more expensive and take more time. And, we get intake forms that have sperm partner just crossed off in pencil. Meanwhile, when done early, egg freezing creates this reproductive freedom that I believe every woman deserves access to. And so we're working on making this normalized, easily accessible, convenient, and supported, and just something that people do as plan A and not just plan B, to really take the pressure off. For me, it was in dating especially, but also in these other important facets of our lives and career. And some of us just want to take our time and travel. And it's all about, for us, giving women more optionality so that they can do more of whatever the hell they want, because the world could use more women doing whatever the hell they want. So that's what we're up to.
Great. Thank you, Alyssa. Bruno?
Yes. Hi, everyone, and thank you for the whole team for hosting this really great panel. I'm Bruno. I'm from Belgium, which is a very different healthcare system than the one we see in the US. I spent 8 years with BCG, the majority of that with the Gates Foundation, on improving access to mainly family planning and HIV in Africa. And that's really what inspired me and my co-founder, Amy, to launch Twentyeight with the mission of improving access to reproductive and sexual health that is focused on underserved communities, so primarily women on Medicaid, uninsured, underinsured. And we provide a telehealth platform that has telemedicine, medication delivery, and ongoing messaging for any service from birth control all the way to menopause. And I'm really excited about the panel. Thank you, everyone.
Thank you, Bruno. And last but not least, Colby.
Hi, everyone. I'm Colby Holtshouse from Organon. I echo the thanks to BCGDB for putting the focus on this important topic. It's great to be here with these wonderful panelists. So Organon is a global healthcare company. We have a focus on improving the health of women throughout their lives. Organon has a portfolio of over 60 medicines and products across a wide range of therapeutic areas. And the company actually just spun out of Merck a few more days than a year ago. We just celebrated our 1-year anniversary, which we call Her Day. And we celebrated that in part by announcing our new ESG strategy called Her Promise, which really does speak a bit to trying to solve some of the bigger problems in our space. I came into the company through their acquisition of Lilia Health, also about a year ago. And Lilia Health was a startup focused on the postpartum hemorrhage space. And so today I'm running the US business unit for maternal health, and we're focused on bringing the JADA system to hospitals across the United States for postpartum hemorrhage control. Currently, we just have clearance for the product in the US. We're working on getting it out to the rest of the world as part of Organon. It's great to be here today. Nice to meet everyone.
One thing I'm really curious about is how some of you ended up in the women's health space and what inspired you to work in the women's health space. Because I was looking at some of your backgrounds and it really seemed like you guys didn't start in women's health. Well, some of you. So really curious on just how you pivoted into this space. And maybe Priyanka, you can start.
Yeah, for sure. So I definitely don't come from a background in healthcare. I actually come from a background in data science and AI, and spent the past 4 or 5 years building a very different company, actually trying to build algorithms to make the hiring process more fair and effective. And it was interesting because a lot of the challenges that we had there were essentially that you have a really biased training set when it comes to the data, right? Unfortunately, if you look at most successful employees in today's workforce, most of them are named John. So you essentially end up training an algorithm on a really biased data set. And it's been really interesting because you actually have a lot of those parallels in healthcare too. But really over the past, 2 years or so, obviously everyone was thinking more about healthcare given the state of the world. And personally, I think, every woman has her own version of this story, I think, but mine is that for my whole life, I've had these just mysterious health problems. I feel like I would go to doctor after doctor and be told, maybe you should drink more water or sleep more, or you're tired or you're stressed. And I was so confused by why nobody had data to look at. And when you looked at data, it was all the same data that I looked at for both my brothers. And I was like, but I have such a different body. My body works so differently. Why aren't we looking at those things? And essentially that's when I found out that women weren't required to be in clinical research until 93. And that to this day, we're diagnosed on average 4 years later than men across over 770 diseases. And then I was like, oh, wow, this is actually maybe a data problem. And there's actually a huge lack of data on the female body. And maybe I can actually do something about it. And personally, I think I saw so many clinical decision support tools popping up and all of these data tools that were trying to leverage, US healthcare data. And I was like, oh my God, none of that data has anything to do with people like me. And if we don't start thinking about that, we're going to start automating a really biased system. So decided to quit my job in the peak of the pandemic, and here we are.
Alyssa, I feel like you have a really interesting pivot into Lilia as well.
Yeah. I feel like I didn't choose this space. The space chose me. I kind of felt like it wasn't even a decision. So my background is in performance marketing and sales. I went from running a window cleaning company in college to helping build ed tech at Top Hat to doing care platform marketplaces. And I came into this space from my own personal story. So I had been with my high school sweetheart for 10 years. After that, I was in another long-term relationship with someone younger than me. And I felt that pressure, that dating math of if I wanted to have kids by the time I was 35, working backwards, I needed to know now, are you baby daddy? And it just was creating this real incredible pressure. And so I looked into what my options were, and I discovered egg freezing. And I discovered that when you do it young, in your mid to late 20s, it really works. but nobody was telling women to do this. In fact, I had friends and later customers who would go to their doctors and inquire about it, and they would be advised to just go meet a husband and have a baby now. And I was just like, damn it, women deserve better than this. And so after going through my own egg freezing experience, I just felt like this is the future. Like in the future, women are going to freeze their eggs upon graduation. We'll celebrate it with a party as the symbolic moment of entering womanhood. And we just need to give it a facelift, market it correctly, and importantly, make it more accessible, more affordable. And so I feel I almost reluctantly stepped into this space because, starting a startup is hard. Starting a healthcare startup is really hard. And then having a startup where we're, creating space for women to do an elective surgery they may not even need is quite difficult. So it really, if it wasn't so aligned with my life's mission of, equality and giving women more options and freedom, then I probably wouldn't have chose it. And so I feel very much like it chose me.
And Bruno, would love to kind of hear from you. I know you're actually ex-BCG, so would love to hear on how you pivoted into that space.
Yeah, no, it's really interesting. It's a mix of a story as well as just looking at the market. But so when I was at Gates, I actually met what was probably the first telehealth startup in Africa. They're called Kasha. They are in Rwanda and Kenya, and they're doing something similar that what we end up doing, which is the first women's health platform over there, providing better access to women's health services to underserved women. And the hypothesis was twofold. Was one, there's actually a lot of low-income people that do have access to internet or smartphones, and two, as mostly young and healthy people, there's a lot of needs that can be handled online with the same standard of care. And personally, actually, for a long time, I hesitated to start the company in South Africa with a friend. My wife did not want to move there. I think it's hard to build a business. As Alyssa said, it's even harder to do it, very far away. So that's sort of what inspired the story. And then I met my co-founder very early on, and just speaking to a lot of people and seeing that resonating was a really interesting validator. The other piece was a little bit more market data driven. Like if you look at the outcomes in the US in terms of unintended pregnancies, in terms of C-section rates, in terms of preterm birth, it's horrible. Like it's the #1 developed country that has the worst outcomes, and I think it's a shame. And I think but that's something we can do something about it. And so that's really where we took kind of a similar idea to what we saw in Rwanda and Kenya, and started in the US, really focused on underserved communities, because we saw in the market, the Hims, the Hers, the Nurex, I think it's great what they do, but we saw very few companies really focused on the people who needed the most. And that's what, got us excited 4 years ago, and still gets us excited every day.
And Colby, would love to hear from you as well. I know you have more of a traditional medical background, but would love to hear how you pivoted into the women's health space.
Yeah, absolutely. And I should say I have a background in medical devices, but not necessarily medical. So I was a history major, and got into medical device because it seemed like such an incredible opportunity to make a difference. I started in cardiology and electrophysiology, and those are spaces where there's so much technology. Interventional cardiology was created by technology. And when you go to physicians, sort of the next thing, they're like, we were here when stents were created, what do you got for me now, right? And then I started, I was looking for something new, worked in neurology for a very short amount of time. And then as I was interviewing, I actually found this incontinence company, the company I worked at prior to Lilia Health. And they had a product for fecal incontinence. And I realized that I did not even know that was a thing that could happen to a person. And it happens to 1 in 10 women, during menopause. And I was like, first of all, holy cow, I gotta fix that like right now. I want to be part of that. And I worked for that company for about 4 years. And one of the things I observed during that time was how difficult it was to raise money as a women's health company. It's incredibly challenging to find investors who are willing to invest in this space. So I actually said, I'm never going to do this again. Like women's health, med device, that combination is too much. It's got to be digital or some other space or something. And then I found Lilia Health, which naturally is a pure play medical device. in women's health. But again, the need was just so powerful when you realize, again, 1 in 10 women who deliver a baby in the United States are treated with some kind of pharmaceutical treatment to control bleeding after childbirth. The rate of transfusions is, between 1 and 2% of women. Again, as we all know, the rates of maternal mortality in the US are really unacceptable compared to other high-income nations, and the disparities are not excusable. And so I felt like looking at this product, having a chance to potentially make a difference, I wasn't sure how I could really go do anything else. So I've been here ever since. And I think that really does characterize many of the people who end up working in women's health, is you feel like you can't do anything different. But the great thing is, because there are so many folks doing it now, and we've seen investment come into the space, I do think the landscape is really changing. So it's a great time to be in women's health. If there are people on the panel who are thinking about it, please don't be dissuaded by my negative stories. I think now is the time. Seeing Organon honestly come into the scene has changed a lot. From my personal perspective, to see a large strategic specifically focused in the space. And I've seen many investors really carving out space in their portfolios for women's health. So cannot be a better time, and I'm really glad to be here.
Great. Thanks, Colby. That was super fascinating to hear about each of your journeys into this space, and how now it's hard to leave. It'd be great to hear from each of you. You already started to talk about this, but what else do you think are the greatest gaps in the women's health space today? Maybe we can start with Alyssa this time.
Yeah, sure. What I see across the board, maybe this is just all medicine right now, but especially in my space in reproductive optionality and freedom, is this insistence on being reactive instead of proactive. And the irony, or maybe the tragedy of it really, is that when we have this mindset of reacting to a problem later, it ends up being way more expensive, causing way more injury. And especially when there are not just biological markers. So for example, let me talk about egg freezing specifically. You can't necessarily measure fertility, but you can measure something called ovarian reserve through a blood test and a vaginal ultrasound. And what this can tell you is the number of eggs that you have. And it'll give you a range saying you're, on average with your age group, or you're particularly high or low. Those particularly high or low numbers can actually be they are really important indicators of what it might mean for your timing to menopause, or to your ability to carry and have a healthy baby. My stepmom, for example, she went into early menopause when she was 36. And if she had been, if anybody had told her to take these tests, she would have seen that, and it would have changed her family planning timeline. And so this reactive approach, and like, oh, women, you'll get the information when I, doctor, decide it's important to you, is really antiquated. And I think this is a huge gap of believing women when they tell you about their ambitions for their lives and reproductive futures. So for example, we've had, part of what infuriated me, but also inspired me, is we've had customers who, like I said earlier, have gone to fertility clinics saying, I'm 26. I just want to freeze my eggs, right? That should be enough. Or I know I want a surrogate later, or, any reason. And they have been told, you should just go find a husband and have a baby now. And like, this is a major gap that must be addressed. And so being proactive, letting women, I think it's really letting them make decisions about their own reproductive futures and their medical futures as well. Letting women do testing, and encouraging them when they have the courage to do something like secure their reproductive futures, instead of kind of paternalizing or pushing women away from taking these proactive steps.
Thanks so much, Alyssa. Colby, how about you? From the perspective of being a founder and also now being at a larger company, what do you think are the greatest gaps?
Yeah, I mean, there are a lot, so I won't speak to all of them. But I do think that maternal health, where we're operating, is sort of an incredible area of unmet need. we created a device for postpartum hemorrhage. The last device that was created for postpartum hemorrhage was invented like 20 years earlier. There are very few pharmaceutical options, and there really just hasn't been any innovation in that space specifically for quite some time. And beyond the hemorrhage landscape, there's other complications that can go wrong, and preterm labor is a big area of unmet need. It's another area where Organon has acquired some early stage assets, and we're very focused on bringing technology to market. There's opportunity potentially mechanically on the device side as well as on the pharmaceutical side to try to address that important problem. And then there are other complications of birth besides atonic postpartum hemorrhage, which is what we treat. And so overall, I think this is an underserved area, and an area where there's not a lot of awareness on the part of patients either, that this is something they should be, looking out for. Their partner should be aware and sort of keeping an eye on mom, both immediately postpartum and, for 60 to 90 days afterwards, right? So I always want to put that PSA out there. I mean, there are so many other spaces as well, endometriosis, menopause. So I won't get into all of them, but I would put a big plug in for the maternal health area.
Great, thanks so much, Colby. It sounds like from a direct follow-up question on what you just said, can you describe the kind of need within the preterm labor space?
The need, the like scientific need. Help me with your question. Sorry.
Yeah. I'm just there was a question from actually one of the members.
Oh,
of the
I see.
Yeah. To maybe just elaborate a little bit further on the need from a preterm labor perspective.
Right. Well, so if your baby is born prior to term, which is 37 weeks, every day really makes a big difference in development. Time in the NICU and time away from mom can have such a major negative impact on development at that stage. So what we're looking for in specific preterm labor assets would be anything that can help control contractions once labor begins. What we're looking at with assets that we have under development is something that can help get baby another 24 to 48 hours, which can be very impactful. Further, anything that can help with early detection or diagnosing a mom who might be at risk for preterm labor could be another great area of opportunity, if that answers the question.
Yep. Great. Thank you so much, Colby. Bruno, how about you? Any other thoughts on what you see are the greatest gaps?
I'm totally aligned with Colby that I think, unfortunately, the list is extremely long. And I think that's the biggest issue in itself. I'm going to pick two to speak about. One is, sexual health education, and the other one is access. And I think, again, the US is scary in that sense. There's 32 states that do not require sex education to be scientifically based. So whoever is teaching sex ed in those states can just tell whatever they want. That is a big issue, and something that starts really early, with teens, and then I think that's the start of, unfortunately, many other issues, especially for communities that, for folks that may live in communities where there's stigma and where there's, the public school system might be the only place where they're able to get some of that accurate information. The other piece is access. If you look at some of the data, 50% of people in their 20s don't have PCPs anymore. People don't invest in, for lots of reasons, but people don't have an easy access to preventative services, whether that's reproductive and sexual health, whether that's sort of general primary care, and just taking these two, when you look at the outcomes, that leads to dire outcomes, right? The US is the #1 country where, in terms of unintended pregnancy rate, so 1 pregnancy out of 2 is unintended in this country, and I think that's horrible. And of course, it leads also to significant cost that could actually be saved and reinvested in better access. And just one story, like we speak to our users like every week. And for example, we were speaking to someone in Texas that said like, I used to have an OBGYN that was 40 minutes away, which already is not insignificant. That clinic closed, and the closest one is 4 hours away. And this is just an example of what many folks are living in this country is physical access problem, economical access problems, education problems. And so this is really why, at 28, we started with, okay, let's not just offer the service, but let's also invest in meeting people where they are, equipping them with, medically accurate information and helping people make, the decisions that works for them.
Great. Thank you so much, Bruno. I want to move us on now to the topic of innovation. Now that we've talked through the gaps that are present in this space, I want to turn it over to Priyanka. Can you tell us about what innovation you have seen in delivery models, and how is this changing health equity for women?
Yeah, totally. I mean, I think that I think so much of what everyone just said, right? There's so many gaps in access and education, all of which I think are areas that need innovation. And we've started to see early innovation in a lot of people using new technologies or platforms to give people access to the standard of care. I think personally, what I'm really excited about is two things. One is innovation in spaces. I mean, first, I'll start by saying I agree with Colby. There's a lot more to be done in fertility and pregnancy, like a lot. But also, I will say that the majority, if not almost all funding that's gone to women's health has gone to fertility and pregnancy. And I always say women are more than our ability to have sex and have kids. And there are so many other problems that we deal with in healthcare that we don't understand why they're different in women because we don't look at them. So I think the innovation that I'm really excited about isn't just scaling access to the existing standard of care, but thinking about how we can actually create new standards of care or better understand these different issues that exist in the female body that might affect us differently or might manifest differently. And like I said before, I think any innovation that starts to remind us why women aren't small men and why we have these conditions that should be treated differently and we should be screened differently, I think there's a lot of room for innovation there. And we're starting to see that kind of come to life, which is very exciting to me.
Yeah, super helpful. Thank you, Priyanka. Bruno, do you have other thoughts as well on innovation and delivery models?
Yes, I will take a concrete example because at least for us, it's telling. And that's asynchronous telemedicine. So it's the ability to message with a doctor, with your phone, to fill questionnaires, to provide medical information, to receive answers, to receive prescriptions, to receive tests delivered at home. I think at the start of telehealth, you had seen like the Teladoc and the Amwell of the world, and it was great, right? It's video-based telemedicine. What we see is that's not what young people want. And sometimes that's just not an option for them because they live in a place where, broadband internet is not fast enough, where they may live in, and again, we focus on underserved, women. And so we see that a lot more, but people live in multi-generational household where it's actually not an option to have a video where your family members can listen to what you say. And so I think that's an example where companies like us are way more advanced than regulation, where what you see actually, there were a lot of announcement at the beginning of COVID that telehealth is reimbursed the same way as in-person care, but it's actually video visits. It's very specific. And there's a lot more than video visits to providing, engaging telehealth, as I mentioned, around texting and ordering tests and chatting with doctors. So that is, for example, for us, something where we see 95% of our users actually engaging on asynchronous visits and only 5% on audio-based visits. So I think it's a good example where regulation can actually provide a meaningful role in improving access to care, especially for the most underserved communities.
Alyssa, I had a bit of a targeted question for you and was just curious on what you thought about innovation in reproductive health specifically and how it reduces inequalities for women in healthcare, because obviously that's kind of an area that you're most focused on.
Yeah, tell me the question again.
So how does innovation in reproductive health play in reducing inequality in women? And maybe it's just innovation in making egg freezing more accessible, but curious on other innovations that you're excited about.
Yeah, well, I am really obviously excited about the innovations in egg freezing. And the way I think about it is, without having the same amount of reproductive time, women are just put in a disadvantageous position in comparison to men, for example. So I think this plays out in a couple of ways. One is romance. Like, people talk a lot about egg freezing in context of career, and that for sure is true. But 80% of the time, we're freezing our eggs because we want more time in dating, and it makes perfect sense, right? Like, if I, as a 31-year-old single woman, am dating, and I'm sitting across the table from a man who doesn't have the same biological pressures on his body, we are just on different timelines. And that creates pressure, and it causes me to rush, and I just have to make different kinds of decisions than he does. And so having this reproductive optionality balances the playing field. And what that actually means is balancing power, right? Like, anytime one person has less optionality than another, the person with more options has more power. And so that's one. And two, when it comes to egg freezing, I think the disparity that I see now that we're directly trying to fix, and a lot of people are trying to help solve, is, and why I think it is paramount employers cover this option for women, is because if I have to spend previously $15,000 in egg freezing, now $8,000 with us, but if I have to spend a good chunk of money on this option, that's 10 grand that my male colleagues didn't have to put into, like, that's 10 grand they could put into the stock market or in other investments. And so it's like, one, this is an incredibly important option for women to have equality, period. And two, it's incredibly important that employers, governments are subsidizing, and, you know, startups and people in this space are innovating to decrease costs, because otherwise that's money that I'm having to spend that my male colleagues just get to put elsewhere.
Love it. Thanks, Alyssa.
Great. So maybe to wrap it up with one last question on the topic of innovation, I'll turn it over to Colby. Can you talk about what role innovation plays in underserved populations globally?
Sure. Yeah, I think one of the biggest challenges for us as a company, every company I've been with, is to say, okay, we have created this innovation. How do we distribute it equally across the world, right? And so I'll just, with using JADA as an example, we can use the same JADA system in all hospitals and all settings in the United States. We have one FDA clearance for one product, but the delivery systems can behave differently when we're in, lower resource settings in the US, right? So when we go to safety net hospitals where there are significantly bigger challenges with budgets and significantly bigger challenges with resourcing and nursing ratios, we have to approach training and education really differently. We have to plan to spend more time to reach the whole staff to make sure everybody has a chance to learn about JADA. We have to come back more often because the nursing teams are just more stretched. They have less time to absorb new technologies. They tend to have a different approach to thinking about how to use an expensive technology. So we have to spend more time talking about the trade-offs of not intervening early and what can happen, if you allow bleeding to go on for too long. Whereas hospitals that we go to that are, higher income, have a majority private pay patients, they have an easier time adopting new technologies. So it can be a completely different sort of discussion and training education model. But then when we look at low middle income countries, which are, truly low resource, we have to completely reimagine the device itself, because some aspects of the device that are workable in the US system are not workable if you don't have a reliable source of power. We think it's trivial to get a syringe to use with the device every time, and it's not trivial to get a syringe every time you want to use the device in some of these settings. So we do have a program that we've had sort of from the beginning of the company. In fact, the Lilia was founded with the original mission of targeting postpartum hemorrhage in low middle income countries. And so this has been part of our story from the beginning, is to think about how we can make the device different and accessible for women around the world. And that's something that Organon is carrying on. So you really have to everything from the delivery and the training to the device itself, and in the middle, the channel that you're using to reach different communities. But we can't just not do it, right? It's part of the moral obligation. But also there is a strong business case to reach the entire globe. If we look at birthing people around the world, there's 140 million births every year, and 4 million are in the US. It's just a tiny fraction of the overall market. So when you look at the population distribution, there's huge markets out there. So it should be attractive if you can think differently and approach those markets with an openness to how different the user needs are.
Thanks, Colby. Yeah, it's very insightful to understand kind of how you need to adapt as you think globally. We're starting to get some questions from the audience, and I think we can turn to those now. You started to talk about business models. For any of the panelists, can you describe your revenue model and where your greatest challenges or opportunities have been with regards to selling into employers, payers, providers, et cetera? Priyanka, would you like to start?
Sure. Yes. We don't sell into any of those audiences, which is why I was like, maybe I'm not the most helpful person to answer this question. We sell direct to consumer, which I think Alyssa touched on this as well. And I just feel so strongly that innovation needs to be delivered to the people who really need it as well. I think eventually probably we need to distribute in many other ways, but I always say that the first person who deserves to benefit from any innovation that we have is the woman herself. And so we feel very strongly about being direct to consumer, giving access to women to things that they've never had access to themselves, right? And I think for us, it's really about kind of, Alyssa, what you were saying too, like so many women are trying to learn more about their own bodies and being gatekept by different people. And we feel very strongly about disintermediating that and trusting women to be smart enough to handle information on their own bodies, on their own time. People have different schedules and different needs, and really thinking about the role of education, right? Because when you go direct to consumer, you really can play this amazing role in being a partner and an educator. And as Bruno said, a lot of people don't know that much about their bodies, right? I think body literacy is a huge problem for women because everything about the female body is taboo, right? Saying the word vagina out loud, like people look at me on the streets of New York all the time when I'm talking about Evvy. And like the vagina is such an incredible and important part of the female body, right? And so I think for us, being direct to consumer was very intentional because it allows us to be kind of the platform, fulfill our mission in so many ways. And I think down the line, we'll definitely have to think about ways that we can continue to increase access to what we're doing and distribute more broadly. But no matter what, I feel very strongly that we always put the woman first.
I guess just to add to that question, Vicky, I'm curious, especially from like the founders on the call, where they see some of the more traditional players fitting in to really help accelerate innovation of some of the concepts or ideas or businesses that you guys have built. So like, how can an insurer work with you, or like where do you see these traditional players fitting in?
I'm happy to take some of the questions, by the way. That's helpful. Yeah. I don't know if this was directed to someone.
Sure. Bruno, let me know if you have a view on that.
Yeah, I'm happy to speak about revenue model, roadblocks for investors and channels. I think that's 3 of the 5 questions. We actually also started direct consumer, similar to Priyanka, and we continue to do that. It's been growing really, really fast. I think sometimes it's also the easiest way to get started and get really good feedback and improve, all aspects of your business. We have now, in addition to that, started to sell to payers and providers. We'll be launching with a very large national plan this summer. Many other plans are, in contracting, and for us, that was really. It depends a lot on what services you offer, right? And I think that's where it can be quite different between. I'm 100% with Alyssa that egg freezing and many other aspects. I think of women's health need to be a lot better covered by employers, government payers, commercial payers. Unfortunately, that's not the case today. But when we speak about things like birth control, it is generally well covered. And so for us, at some point, there was a realization like if we want to have the biggest impact and really help millions of women in the country, we need to go to the people that actually pay for the services, which are the Medicaid and the commercial plans. And so that's kind of a second business line that we launched. And to make it concrete on the direct to consumer, we make kind of a monthly fee per user. And on the payer side, we typically have value-based care arrangements where we'll do a per member per month fee for access for all the services, and we'll have upside and downside risk based on certain outcomes that we deliver. For example, reducing unintended pregnancies. In terms of investors, I think it's a very relevant question, especially given the current environment. Full transparency, we are raising our Series A, and so far overall it's been going really well, but it is a lot slower market than what we have seen at our seed, what we have seen last year and other times. And so I think the one investor I think put it well, there's always going to be money for smart people working on smart ideas, but it is a lot harder, and there's limited pressure in the market to make decisions fast. And so I think one thing we have seen is, I think starting, like if you need funding, I think starting early is not a bad idea, because investors have no incentives in moving fast at the moment, and they are all trying to make the most risk-averse decisions. And then on the channels, I think that's something we also do quite differently at 28. No offense to people who do it, but we personally don't see digital advertising like Facebook, Instagram, Google as a robust, differentiated approach. We acquire 80% of our users through what we call consumer partnerships. So actually partnerships with cycle tracking apps, with other social services platforms, with nonprofits, with community colleges, and it's been a really effective way to acquire a lot of customers at low acquisition cost.
I have something I would like to say on this topic, and I think like the founders either here or listening will really get this. So we go direct to consumer, and if I could tell you the number of investors, everybody who's like, Alyssa, why aren't you selling into employers? And the reason is because it is so important to me that we are building for women who want reproductive optionality. And as soon as we start selling into insurance and into employers, I, as a founder, get disconnected, even though I'm our customer. It's just easy to get disconnected from who you're actually building for. And so by disciplining ourselves to stay direct to consumer right now, it forces us to every week, I'm obsessing about how is this woman's experience, and not how can I get this HR person to believe that the women on their team deserve equal access to this. And so at least for the foreseeable future, we get companies coming to us saying they're interested, and in which case we entertain it if it's going to be easy. But until we have built something like really big that gives access to a lot of women, we want to stay focused on who our actual customer is. So that's why we've stayed D2C for now.
Thanks, Alyssa. Colby, I'd love to get your take as well.
Yeah, well, we're at the exact opposite end of the spectrum, where we sell directly to hospitals. And, quite frankly, patients don't have a lot of agency in selecting therapeutics when they're in an acute emergency situation. We can talk about whether that's right or wrong and how much we should educate women to be able to advocate for themselves in that time. But honestly, postpartum hemorrhage is a true emergency, and you're going to have a whole team of people in there, and you want them following an established protocol, because all 6 of the people in the room have a different distinct job that they're all running in parallel. That's in some ways really best not to mess with that, right? With that said, I'm still a big proponent of educating everyone, and so that what's happening to your body in that scenario. But nonetheless, so our focus is entirely based on HCP education, healthcare providers, so doctors, nurses, midwives, all the folks who are involved in deliveries, and our customer is hospitals. So the hospitals, because they're paid on a bundle for childbirth, they have to decide how to allocate those dollars themselves. So we don't even really directly work with payers, which is a little bit unique, just based on the inpatient setting that we're treating in. But I've worked in other women's health products where, it's still a prescription product, and, physician is involved in either the fitting or, something like that. And there are insurance payments involved that you really do have to think about. And you're always going to be benefited by the great DTC ideas and concepts that I think the other panelists have described, because then you're getting women to think about what they want, and they're coming and advocating for what they, the treatment they want to pursue, especially when I think about, the quote unquote lifestyle diseases like incontinence. I don't like that word, but that's sort of the category that an insurance company would put it in. They would say, this is a quality of life issue. You really have to come with clinical evidence. So, we can't just sort of show up and say, oh, our product has these benefits, or, there's design differences. You have to come with real, solid, peer-reviewed, published clinical literature that shows your product is better than something, better than the status quo, better than nothing, better than a competitor in the space, or else it's very hard to get the attention or approval of insurers.
Great. That makes a lot of sense, Colby. And I think we're really seeing the spectrum right across the board with you, our panelists, working in different areas of women's health and different business models that are needed in these different areas. I'd like to move on. We had a couple questions from the audience around funding. One person asked, I'm curious about what strategy, stories, and metrics were most effective to secure early stage funding. And also, what are some of the roadblocks you faced in getting investors and partners on board? How about Priyanka? Would you like to take this one?
Sure. Yeah. I guess just to give some context for my story, we are a seed stage company. We raised $5 million led by General Catalyst, which is they do a lot in healthcare, but they're also just kind of a traditional tech VC. I would say that one, if you are somebody who's thinking about women's health, I would say finally maybe someone cares and we'll talk about it. I can't tell you the number of VCs who were like, oh, we've been waiting to make our women's health investment, or we've been looking to make our women's health investment, as if it's a single investment that they'll make to check a box. But a lot of people are looking to do that right now, for better or for worse. So people are interested. Finally, it's almost like everyone at the same time realized that healthcare is one of the biggest contributors to the US GDP, and women are half the population. So there's actually a massive business opportunity there. I will say that when I was toying around with a bunch of different ideas, a lot of the male investors I talked to were not resonating with the problems. And it was funny because when I landed on vaginal infections, a lot of the men were like, oh, I know that problem. Or oh yeah, that's why I can't have sex sometimes, or whatever it is. So it actually made it a lot easier, because almost all the men were like, oh yeah, my wife has this problem, please help us. But so that was a funny part of the story. And definitely could see people cringing as I said the word vagina for the first time in a partner meeting or whatever it was. But I will say that there are so many more women in venture now that you don't have to have those experiences, and you should seek them out. And I found that so many of them were so supportive and introducing us to people and trying to help us. So I would say it's not all doom and gloom, and there are people who want to help, and you just kind of have to find them. And obviously the problems in women's health are massive, truly the numbers are massive. So showing the size of the market is really, really helpful. And then really explaining why you and your team are well set up to help solve that problem. And I think that, to Bruno's point, if you're a smart person with a big market and a big problem, and you have a great group of people, I think early stage funding is there. And I don't think that, everyone should not innovate for the next 2 years out of fear that there won't be money, because I don't think that's going to be the case, especially when the problems are this big.
Thanks, Priyanka. Bruno or Alyssa, anything else you want to add with regards to getting early stage funding?
Yeah. So we, what worked for me anyway, I raised at 2 times, one definitely the worst time other than right now, which was March 2020. We were finishing our Y Combinator batch and the world was literally melting. And they were kind of like, good luck, go raise what you can. And what really worked for me is the way I've thought about the company and fundraising each time is I literally just ask myself, is this company one that I believe can be so big that I'm willing to spend the next 10 years of my life working on it? So I remember the very first time I even thought about working on Lilia, I was still at my full-time job, and I was spending, I had a deal with myself. I would put in 100 days, I think it was 100 days of non-0 days. So I just wanted to investigate, is there something here? And so I would wake up at 6 a.m. from 6 to 9, I would go to a coffee shop and work on the company, and just to see, is there something here? And what I ended up doing was I ended up putting up a splash page and spending like a couple $100 on Facebook to point people to this theoretical product to see, like, if I built this, would anybody even want it? And it ended up going super well. And so by that point, I could tell a story that was just, look, I have this problem. I wondered whether other women have it too. I spent almost no effort confirming that hypothesis. And oh, by the way, then I looked into the market, and it's huge and it's growing, and we're at this, perfect intersection in society where it's part of the, it's like really part of the societal narrative. And so to me, the bar I just hold for myself is like, do I believe that this is something that could be really huge? And I just am terrible at lying or faking. Like, you just can always tell what I think and feel. It's written on my face. And so I kind of need that bar, because then if I believe it, then I get really excited. And then it's really easy for me to get you excited about this opportunity. And so far, that's what's worked for me. That said, now I'm actually really excited to get into cash flow positive, which is in the imminent future for us. And we'll fundraise surely again, because this is a massive opportunity and we want to go fast to get there. But what I love about this is it just puts us in control of our own future and creates a different dynamic in any fundraising conversations we might have.
Awesome.
I know you didn't say my name, but I feel compelled to just jump in and say that from an Lylia perspective, we had great success raising from social impact funds. And I think it's a group of investors that not everyone is familiar with. But the concept behind an impact fund is that they're looking for venture returns. So you need to be, working on a technology that has a market. But they also want to have a contract in place with you, or an agreement in place that you're doing something for the often the low middle income countries, or some kind of other underserved population. So we had a couple different groups that were invested in us: the Global Health Investment Fund, AXA, which now has a social impact fund. And those investors are wonderful because they're mission driven, they're supportive of what you're doing. They're trying to solve, big global health problems, and they sort of help you think about how to carve out a little space and time to go after the global health angle, as well as your, for-profit motive. And it worked really well for us. So I always encourage people to take a look at those investors.
Thanks.
Can I add 2 things on the fundraising?
Go ahead.
Go ahead. Yeah, I just wanted to build on something that Alyssa and Priyanka said. And for us, that's like, we've been fundraising 3 times. Right now it's the 4th time. Yeah, maybe it's a little bit too much, but anyway, there's, I think, 2 things they said, like, that's been a key learning, and to be honest, I wish I knew it up front. One is really like, we now spend a lot of time only talking to investors that we think are a really good fit. And I think the first round is I talked to every single person who wanted to talk to me. And honestly, like, I know I'm a white guy, but I had very similar experiences with typically, white, older male investors, where what we did was just not resonating. And we lost a lot of time, a lot of energy. And right now we spend a lot more time on only, like, actually a lot more prep, or like, what are the few investors that actively invest in this space, have not made a similar bet, are the stage, like, check-wise, exactly the type of amount of money that we're looking at, and can be really helpful to us. And so we tend to speak to a lot less people, but have greater success. And I think the other one, Alyssa said, I think cash flow positive is the holy grail. I mean, it gives you incredible freedom. I have a friend who is cash flow positive. We are not, and I think that makes a big difference. But right now, I think there's a higher emphasis on that. Like, if you raise money in this market, like, what's your path to profitability? How soon can you get there? Or can you even be structurally cash flow positive, right? Like, maybe you are not because you invest in growth, but if you invest less in marketing, can you actually run for a long time? And I think that's a good thing, to be honest. I think there's been way too much investment, including all the way to IPOs, in companies that make little sense and make no money. It's great for us as consumers to get stuff that should cost more, or should not exist. But I think we'll see a reset, and I think a lot of the best companies with solid business model will survive, and ultimately I think that's a good thing for the venture space.
Okay, can I add one thing? Just building off what Bruno said. This is me. Okay, when I saw the market was melting, the first thing I thought was about how many more female-led companies were going to survive. Not only because female founders tend to be particularly prudent, they're less likely to run out of cash, they're more likely to have really sound fundamentals from the beginning. But I think a lot of women start companies mission first. And a lot of what we've talked about here is like, we do it, not that dudes don't, Bruno, but I think disproportionately for women, and that just more female-led companies, we're going to make it through the downturn because of our prudence, because of the good fundamentals, and because of that mission-driven, I just have to do this for my people, like for my fellow sisters.
Well, I think we're actually at time, and I actually wanted to ask a couple more audience questions, but I think that's it for us. So just wanted to thank everyone really for joining our first healthcare practice area innovator session. And we're going to be doing this quarterly, like Vicky said. So when you leave, there actually will be a survey, and you can sign up to be notified for the next panel, which will happen in the fall. And if you have any ideas of companies or panelists you'd like to see or certain topics, just let me know. Just message me, and happy to try and put that together. So thank you so much on behalf of BCG. Thanks so much, panelists, for joining us. And thank you everyone for attending. Really appreciate it.
Thanks, everyone.
Thank you. Bye.